this topic will be interesting for you. I try to share my screen for you at this moment, and want to say before just a big hello to all of you. It could be good morning, good day, good afternoon, or good evening, whenever you are in the world. So welcome to today's webinar, and let's jump in. Our today's topic is called the Insights to Global Addiction Education, and I will show you the most interesting and most gathered knowledge we have about the university education. Hopefully you will find anything about your programs, about your colleagues, your faculties, and if you have any comments, I will very welcome if you could share it in the chat, and we will come back to it later. When I already introduced myself, I just want to make a short disclosure for you, and also in this place to share my thanks to the co-authors and colleagues from the ICUDDR board, and also my colleagues from my department. You can see their names, and they are also the authors with our papers you will see, and you will be the opportunity to get shared with me afterwards. I would like to thank also to the ICUDDR board for letting me share all the results we have from the surveys and from the paper we already published in professional journal. And lastly, I would like to say a big thank you to all of you, all of the ICUDDR members who participated in the survey, because without you, it wouldn't be possible for me to sit here and sharing this comprehensive data we have now. So thank you, firstly. And before I get closer to the topic, I just wanted to tell more about myself, or about my background to the topic. Why is it just myself to present this? Why is that? How it happened that I'm presenting the insights to global addiction education? You already heard about my educational background, and just want to mention and emphasize for you who doesn't know that the university-based program called Addictology in here in the Czech Republic at Charles University is the first and the only academic program in such specialization in the Czech Republic, and we have all levels of education from bachelor's to the doctoral level, and also like lifelong learning trainings. And this is what I graduated in, and like going through my studies, I started to participate in teaching and helping in creation the study program, still getting into contact with our students and my schoolmates. So it was just somehow directed my way to the Department of Addictology, where I started working. And then my doctoral thesis was specifically focused on preparing an overview of available educational options in addiction studies worldwide. We were looking for all programs available at the universities specifically, and that was the first part I will show you today. And the second topic I am involved in is the employability of the graduates of the addiction studies programs. Specifically in the Czech Republic, it was the Addictology program graduates, but I'm really interested in other graduates from the world, how they are successful in getting their jobs, and how they are going after finishing their studies. Logically, we published findings from my thesis, from my work, from the topic of education, and during that years, the visibility of this topic raised, and also my interests, my collaboration was getting closer with colleagues from abroad and from the Czech Republic. And many of you probably know my boss and my leader, Michal Mijovský, who was also my supervisor for PhD thesis, and we are working in a close collaboration till now in the topic of education. So that's who is the main in my small team focusing on education in addictions. Then ICUDDR was established, we became members, we started to participate a lot, and in last few years we really were partners for the board and helped with the surveys and making some kind of supports for ICUDDR. So there was another milestone I would like to share as my background. We collaborate with many of you, with colleagues from all regions from the world, and that's what I really like in this kind of job. Also, the topic of addiction education is increasing in the world per se. It's putting emphasis on education quality. We are discussing competencies and related minimal quality standards for education, and that's where we continue in next steps. So as you can see, I really found myself in this topic, and that's what I'm really into it. Leading my students, doing projects on similar topics, and that's just another baby of myself coming, and that will be a center for research in addiction education, established at the Department of Addictology here at Charles University. So when I will be communicating with you, maybe in the close future, it will be under the head of this Center for Research in Addiction Education. So I'm really happy about these steps happening. And this is just a mission of my work, and also of the whole rationale for this topic, for the education, because our mission is to provide quality addiction care for our people having substance use disorders or behavioral addictions, and we can't do that without having quality workforce. And quality workforce needs to be educated properly and according to the needs from the practice. And for having quality education, we need to support our knowledge by quality research, and that's why we are here today, to share some research knowledge. Just for an example, and you will have all the papers stated at the end of the presentation. Of course, you will have also the opportunity to get all the papers if you would be interested, just for you to know what have been published for the topics of education in addiction studies by us. And of course, there are a lot of colleagues publishing on related topics. You will see that again in the reference list at the end. The aims of today's webinar are clear, I guess. I would like to introduce you to the topic and try to share my enthusiasm with you, and try to encourage you to be so amazed as I am from this field. I would like to share the current knowledge about addiction education, mostly focused on university-based education. I will present in the first part the knowledge from the so-called mapping survey from my PhD thesis. And secondly, I will share all the results from the ICUDDR survey 2023. And at the end, we will have the opportunity to discuss possible challenges, some future directions, and share suggestions you would have. And last but not least, it's definitely the case that I would like to connect to you and collaborate if there is any chance or any interest. Let's do it. The structure is copying the aims, and I will get more deep into the rationale for the topic. Just want to emphasize the importance of the research and evaluation generally, because this is unnecessary part of our work. I bet that all of you need to do some kind of evaluation or research for your work, for your activities, and it's the same for us, of course, at the university, and also for the ICUDDR as they are interested in feedbacks from their members and colleagues. The feedback and having some information about how we are doing and what we can improve, how we are efficient, what is not working so well. It's the key part of education and also the research. We need to also reflect on how we are successful in filling the needs, and we need to collaborate because the universities now are gathering perfectly, but few years ago, it wouldn't be possible to collaborate like this. There are almost 500 members in the ICUDDR. It's quite a lot, and we need to work together and join ourselves to make our power stronger in negotiating in the field and in supporting the whole education and workforce preparation in the field. And this is also encouraged by the literature and my colleagues. It's more than 20 years they have published these notes, but they were talking about the emergence of new specialization, new clinical practitioners in the form of addiction specialists. And they were talking also about the specialists in addictions who are rooted in other disciplinary bases as medicine, psychology, social work, nursing. And these are together creating a new profession, a new area of specialists. And this is really interesting to look back and see how it was going, how the process was happening. Before showing you the concrete findings, I just want to make sure that you have the same thinking about the meanings of the degree levels or educational options I will be talking about, as this is really important and really different in various parts of the world. And I will try to be as clear as possible in the degree levels as bachelor's, master's, or PhDs. And when there are really specifics, I will tell you that this is something specific to each region. The first educational option and the main one I'm really interested in is the degree level. This is meant to provide basic or advanced education at those real degrees I mentioned a while ago. And this is bringing you the qualification or specialization for the field, no matter what area we are talking about here, addiction field. The second educational option could be the so-called academic courses in addiction topics. These are usually meant for students of other disciplines at the universities, other study fields, such as mentioned psychologists, social workers, medical doctors, and they are taught in addiction topics specifically, but in their disciplines. So it's usually just one course. Sometimes it's compulsory, sometimes it's voluntary. It's good if it's included in the curricula, but this is something what can or cannot be. It's not the same in all regions. And the last category is the lifelong learning, or respectively continuing education in addictions, which is representing the level usually following the graduation in the degree level. And it's meant for students, for graduates, also for clinical professionals and other colleagues from the field who is interested. They can join this kind of courses. So I will cover all these educational options during the presentation. So hopefully it's clear enough for you now what I'm going to talk about. This is the first part. This will be the findings of the mapping survey I did with my colleague Michal Mijovský during my doctoral studies, and we are still living with these data, with these findings. Hopefully our next paper is going to be out this year related to Australia and New Zealand. I will tell you more later. But this is the methodology, just for you to know what was the key process of data gathering and related limitations, because this was not, let's say, the high research and high methodology. It was just through the internet search and content analysis of the university websites. We tried to identify the addiction studies programs available at the universities at the whole world, but according to defined keywords. You can see them listed on the slide. And we made the data collection during 2016-17, but because it's quite a long time ago, we made some updates in 2023 to enable publishing of the data now. So the main aim was just to provide an overview. It was just the first attempt to do so, to provide the comprehensive list of universities and make it easier to connect and collaborate. We excluded the continuing education and also summer schools and non-university-based programs as described before. The main limitation is in the language used. We used only English, and that could be a trouble for some regions in the world. You will see that later in the presentation. I tried to fill this gap with my colleagues' data. Of course, the websites really differ in their quality and in their details they provide. So we only used the data which were available publicly. So some universities had only limited information about the programs, and then the findings are as they are. But as I mentioned, the main strength was that the first attempt was already done, and we could continue in this work what's really happening in reality. It's my pleasure to show you the main findings. Maybe some of you have read the papers for each region separately, and now you can see the data presented all together according to the regions. Sorry for Asian data, because there was the language limitation the highest, so it was not possible to present the data reliably. It was just few universities, and we didn't publish the data yet, so Asian data are not provided in this part of presentation. I will try to compensate it in the next part from ICUDDR survey. Here you can see the total numbers of the universities identified through the survey, and also the number of programs in addiction studies provided at these universities. Blue are universities, orange are the programs. You can see that in total it's almost 500 programs identified, which is a beautiful number, and as I mentioned, Asian data are not included. So, and also, like, we can definitely find more if we go deeper and change the language, for example. There are differences, and I will get closer to them at the end of this part. You can see the comparisons between USA and Canada, to Europe, Australia, and New Zealand, and Africa. This is maybe logical, I guess, but I will show you the concrete educational options available in each region, and that's giving us some kind of explanation for why is it as it is. Here you can see also the regional structure of common degree programs provided, those three basic levels: bachelor's, master's, and PhD. You can see that there is quite a low number of bachelor's programs in blue. We can see that the highest number is represented by the master's. This step can be logical, and also quite a low number for PhD programs available, which can be logically explained just because it's quite specific, and it's really preparing the students for academic career or research career. And from my experience, that is not what most of the students would like to do in their career. They prefer to work as the clinical workforce, And these are mostly why the masters are the highest represented here. I mentioned it before, just the extra comment to the US specifics, as we identified almost 400 programs. And for your comparison, here are data from Talev's work 20 years ago. He also tried to make some kind of list of addiction studies programs at the universities, and they identified almost a similar number of programs. This is good. We try to discuss some steps and trends in the numbers in the paper, and it's visible that the trend is going, at least in the US, and possibly that's because the educational system is quite different, and also the licensing processes are different. That there are more than 50% of programs provided at the undergraduate levels, usually at the so-called associate degrees, which are mostly 2 years, and undergraduate serving to prepare students for employment or for some next level of studies. For example, if they are not admitted to the bachelor's, they can start with this kind of education before. And there are a lot of certificate programs in the US. It's not so common in other regions, in Africa and in Europe. Definitely, these are not the ways they go. Thanks to my colleagues from Spain, I just want to share short findings from their study, because they took the opportunity and tried to completed our data in Spain by using not English but Spanish, and they identified 13 active university specialized training programs in addictions at the universities in Spain. These covered all degree levels, being mostly theoretically and practically focused, related to all areas of addiction field, from prevention to treatment, rehabilitation. This is a really important piece of work. And if you have the similar data from your regions, or if you have interest or some passion to do so, let us know. We will be pleased to help you in sharing the methodology or something, and we can continue in gathering these pieces together, because language is, it seems to be quite important for gathering the data from the whole world. As I mentioned before, the most of the workforce, or most of the graduates from the addiction studies programs, are preparing for a clinical workforce. We needed to look deeper or closer for the clinical preparation within the curricula. You can see it provided again, regionally specific. Here we don't have the US data, because it was 400 programs, and we didn't get so deep in all programs separately. You can see how many programs are providing the clinical practice. Just be careful, it's the number of programs providing clinical practice out of those who provided this information again at the website. So we can't say that it's just half of the programs, approximately. It's just more than 30 programs from those who stated this information availably at the websites. So for most of the programs, still the clinical practice or internships or some practicums are the common part of the curricula. They stated also the length or some specific conditions for taking the placement. Many programs, especially in the Australian and New Zealand regions, and also for some European programs, require the clinical placement or some work experience even before applying to this study program. It's quite interesting, and we try to discuss this trend or this process in our upcoming paper for Australia and New Zealand. Getting even deeper into the curricula, you can see the most common and most represented courses within the curricula. you can see it's structured according to the number of repetitions. So the number 1 in blue color is the most often mentioned courses within the curricula in Europe, Africa, Australia, and New Zealand separately. You can see quite high proportion of research methods, also logically counseling skills, assessment, intervention, treatment, pharmacotherapy, motivational interviewing, and also the focus on mental health and ethics and professional practice. These are, like, you can see that regardless the region, they are quite similar. They have a consensus in what is necessary for preparing the addiction workforce, preparing the clinical workers. But you see also that there is quite a lot of topics missing, let's say, and we can really agree on that. In this study, prevention was really underestimated in the courses and also in the curricula and topics of the whole addiction study programs. And also, this is the same for harm reduction topics, for harm minimization, for justice and law, and also for the topic of gambling specifically. But I will get back to prevention and harm reduction later again, because I find it really interesting and important to think about how we define addiction field and how we define our work, and so how we prepare the future professionals for working in the field. This is something what we can say it's common for all the regions I presented, and what is quite specific for each of them, because they have really various educational systems, and so various educational options for people interested in this kind of studies and this area. In many regions, there's the vocational based education available. It's not so common for Europe, but it is definitely common for the United Kingdom, for Australia and New Zealand, and can be also in some types of educational options in the US, possibly. There are various backgrounds where the programs are provided, where what faculties or departments operate the programs, and this can really influence how the program is looking and for what professionals it is prepared. I mentioned before that there are certification and licensing processes. Again, it's different in each region. There are different requirements for the professionals, and this can be a trouble for making clear comparisons. Again, languages, that's the main topic in what we do. And I can sum up that most of the programs are focused really specifically on addictions. It's perfect that we see so many programs really specialized in this issue. And we see also a lot of others programs in related disciplines which try to specialize in addictions too. So we can then see programs, for example, called addiction psychology, addiction medicine, addiction nursing. So we can see these two types of specializations, the primary specialization per se, or specialization following the more general discipline which people are educated in. PhD programs was just 9 programs for the whole world identified. So we can say that this is really specifically for a narrow group of applicants, and I think this is all right. This is a logical step. And we can also say that seeing all the programs and all the curricula, we can have a consensus on comprehensiveness of the academic programs, and we see that we really cover all parts of the transdisciplinary approaches which are valid for the addiction education and also for definition of addictions in general. We don't know what role it could play that the ICUDDR and also ISAP have been established in a few years ago. But I can say that it can be influenced by bringing these universal prevention and universal treatment curricula for the universities, as they are able to prepare new educational options for all those interested. And there are related issues to if we develop new programs, and also if we have established programs operating for many years, we definitely need to take care of also the evaluation and also being involved in the legislation processes, trying to help our graduates to get a job afterwards. And it means that we need to relate our education to the career ladders in the countries. It's not possible to generate new professionals without having places where they can be employed after graduation. It took us also to the question of how to differentiate the programs, how to prepare specific skills and specific requirements for programs that are on bachelor's level, that are on master's or PhD possibly. We need to specify maybe these categories separately and focus on the ladder also in the education, how you can improve yourself and increase your competencies within the field. And also, it was already mentioned, but we are really interested in other professionals to be involved and to be interested in addiction issues, as even though they are not specialized in addictions and they don't work in addiction field, they definitely need to be educated as social workers, medical doctors, again, nurses, teachers, for example. We need to educate them too in addiction issues, to be prepared to, for example, screen their patients at the beginning or make some kind of short intervention or motivational work, and then send their people, clients or patients to the specialized services. This is just for your note. I won't get deep into this, but the table is representing the first typology of addiction studies programs at universities we try to propose with my colleagues. It also have been published, so you can get the access to the paper and read more about how to apply it for your educational options at the universities. But you can see the diversification or structuring the addiction studies programs according to three conditions. If they are meant as a primary specialization from the scratch for people who are really into the narrow career in addictions, or if it's for people who are knowledge and experience in other discipline and want to get deeper into addiction issues. We can differentiate the level of studies, and also we try to differentiate if the program is clinically, theoretically, or research oriented. It is different how the professionals are viewed in the regions. Sometimes the addiction specialists are those who are medical doctors with some extra education in addictions. Sometimes it's like in the Czech Republic, we have the generic professional who is able to do, let's say, everything from prevention, harm reduction to aftercare and rehabilitation. So it really depends on the region and really depends on the university who provide the program. We also try to test the functionality of this typology on the ICUDDR universities and ICUDDR survey. So you can read also in our upcoming papers some critique of the typology, what's missing and how is the reality of educations and how the typology could be adjusted according to this feedback. That was the first part, the survey mapping. I will be comparing some data later in the presentation, but now let's move on to the ICUDDR membership and ICUDDR survey data I would like to share with you now. Possibly many of you are the members of ICUDDR or represent universities, so you know ICUDDR, but in case that you don't, ICUDDR is the consortium who gathers university and education providers in the addiction field and try to make them collaborate, enabling them developing of programs by providing universal curricula, by providing support. Sometimes even it's the financial support, and they also realized the conferences like the one in Greece 2 months ago, where many of us met. So people can meet, people can share knowledge, exchange information, exchange experiences, and this is really what we needed for us to be stronger. As I mentioned before, 452 members now of ICUDDR from the whole world. You can see the proportions in the colors here, how is the structure for each region. We can see that Asian and Pacific and African universities are most involved, most interested within the ICUDDR. It's also by the support they can get from the US, from the ICUDDR and the governments. It's really important to help them develop. We see some European universities, it's nice, and Latin American universities. There's a little number of North American universities, and I will get back to this point later. Again, I don't want to repeat myself, but ICUDDR surveys are very important tool for the ICUDDR board to get known from the members what their needs are and what steps can be done for them to be supported in a better way. It's a way of communication for us and also the platform for creating joint degrees and collaborations for sharing. So we really need this, and I would like to kindly ask you if you were or weren't involved in the last survey. We will definitely make another wave in the upcoming years, so please share with us your knowledge and try to be involved in what's happening, as this is really important for us to be clear in following your needs. This is again a description of the methodology of the ICUDDR survey between members. You can see that it was the 2023 data. The last wave was conducted in 2021. We tried to adjust a questionnaire a bit and make it easier for you in an online format to provide data, but still there are a lot of limitations. The questionnaire was really long and time-consuming, not so easily provided information, as it requires some head of the faculty or someone who is really knowledgeable about what's happening behind the whole educational process and educational options. So this can be definitely improved for the next wave. And we tried to cover all the educational options I presented at the beginning. And this survey was consisted of 99 respondents, 99 university members. So the response rate was 25%, which was the highest actually in the history of these surveys. But still, as you know, that there are more than 400 people or universities involved within ICUDDR. This is just a quarter of all members, and we are really interested in more of you. So I will share the main findings with you again. Some of you maybe saw these pieces or just some pieces in Greece, so sorry for repeating myself, but hopefully you can focus more for a while in here than in Greece. It was faster. You can see here the regional structure of participants within the survey. Again, you can see that the most participants were from Europe. It was quite nice because you can see the percentage in the brackets for each region, and more than half of the members from Europe participated in the survey. So this is great. And you saw that Asian and Pacific and African universities were the most represented within the ICUDDR members, but here we can see that 20% of those participated in the survey. So this is something what we can maybe encourage more to be higher in their participation within the survey. Only 6 universities from the USA and Canada. Again, this is one of the gaps we witness within the ICUDDR, and we are discussing how to fill this gap. If you will have any idea, definitely share it within the chat or after the presentation within the discussion. I would love to hear it from you. What do you think? Here are the structures of degree programs provided. That's the number one, the first category of degree programs. You can see that 35 universities share that they provide any degree or certificate programs allowing their graduates to get the qualification. Other 60 universities provided other educational options, which will be described later. Again, the similar structuring as in the mapping survey for bachelors. You see that's, again, quite a low number. It's 5 bachelor programs. You can see the masters and postgraduate opportunities or options, which are certificates or diplomas mostly. And you can see that there are more PhD programs that than it were in the mapping survey. This is quite important. We can even see that it's 12 programs in European region, and we know that it was only 9 in the mapping survey for the whole world. So this is a positive information for us, that we know there's more opportunities for all of you who are interested in this kind of education and career. For your information, how many universities provided more than just one educational option? You can see the combinations and the number of universities, and 14 universities from those 35 who provided a degree program. 14 universities had only this degree program, and others have also other educational options. So it's quite common to have the degree level or levels at various educational options, and then academic courses for other colleagues from or students from different disciplines, and also lifelong learning trainings for those who are after graduation or already working in the field. This is quite nice. I think it's important for the universities to be in contact with the professionals or with the people who are at the beginning of their studies and their careers. So this coverage, I think it's important. These are the academic courses. So the other educational options than degrees, we can see that it's repeated that mostly these academic courses are meant for students of psychology, social work programs, psychiatry or mental health, or medical students in general. We can also see pedagogy, nursing, public health, and health sciences programs. It is somehow covering the biopsychosocial, social, spiritual model of addiction. We need to cover all these aspects of what can be influenced by addictions and substance use disorders. So these fields aren't necessarily related to what we do in addiction specialization. 19 courses were identified specifically, and we can see also the topics of these academic programs, academic courses. In the next slide, I just want to mention that it's quite similar with the topics as it was in the mapping survey for harm reduction, criminal justice and law, specific target groups. Also public health and harm reduction is underestimated here as well. Here you can see a comparison of topics of education on the levels of academic courses on your left hands and lifelong learning on the right hands. It's quite similar again, but here we can see a difference, a huge difference in how prevention and topics around alcohol or addictive behavior is represented. This is important for us that ICUDDR members are involved in prevention, and they provide prevention-specific educations in all levels, all educational levels. And then it covers the similar topics of being more clinically oriented, as we saw in the topics in the mapping survey. 40 universities stated that they provide lifelong learning programs too. 24 universities stated that they don't. It's the same structure of those professionals for whom we provide lifelong learning options and trainings, and they are provided mostly in traditional face-to-face format or in combination with some kind of online programs. This can be a specific of addiction studies or helping professionals education in general, because we prepare the clinical workforce mostly, and if we need to prepare students for the clinical work, we need to meet them. We need to practice some kind of techniques, motivational interviewing, or providing internships, and it's not easily possible to do it only online. So I'm happy that this is happening, but for many regions, it's on the other hand, it's not possible to travel a lot, or they don't have enough financial support for studying. So e-learning format or online courses can be the way. This is another important information that 22 universities in 2023 stated that they prepare some new program, that they have some program under development, which will be open in upcoming years. So if you have anything to be shared, then please share it at the end. And more than 60% of universities used UTC or UPC for preparation of new educational option. And we can see that these programs are developed in Asia, Europe, Africa. So the coverage is, again, the global and internationally used of the curricula, which I find it's really great feedback for the ICUDDR and its tools. We asked specifically not for the clinical internship within the curricula, but for the clinical work experience of the students who are studying the addiction study programs. ICUDDR was really interested in this data, but I'm not sure if all universities provided really the data about students working during their studies, because you see the quite high proportion of students working during their studies. But afterwards, I was thinking about the numbers and some possible explanations. And it could be that many students in various regions are mostly well-experienced professionals already. So they work and decide to increase their educational qualifications. And that means they are, of course, they are working during their studies. As it's different, for example, in the Czech Republic on the bachelor's level, where students are mostly 20-year-old people starting their careers, and mostly they are really focusing on studying, and then possibly during their masters they are start working in the field and combining studying and working. Back to the UPC and UTC, as this is the important feedback for ICUDDR and ISAP, which provide these tools to the universities. You can see the comparison between the degree level academic courses and lifelong learning trainings, how they use UPC or UTC curricula in their content. And we can say that the higher the educational level, the most likely there are curricula implemented within the program. We can see there are differences in the usage of UPC, which is mostly for the degree level, and oppositely the UTC is mostly on the lifelong learning level. can be somehow interesting for us to discuss this more and compare the usage of the curricula within the educational options. You see, this is the confirmation of what I'm talking about now. These are the tools provided by the ICUDDR, and it's used by the universities. Except for the curricula, good practice examples are very well known and used by the universities. Also, e-learning materials provided on some educational options like the webinars, sharing the videos or something like this. Also, the practical trainings and workshops ICUDDR provide to those interested in future or current professionals in the field. Universities are often visiting the ICUDDR website, but what was quite underestimated was the option of academic mobility or exchange study programs, no matter if it's for students per se or for academic staff. We can maybe encourage these tools for more in the future, because this can be a way how to share more. This is what I meant, and I just want to raise it once again. This is something what we need to consider deeply and focus on how we deal with addiction and substance use disorders, how we deal with all definition of addiction area. What does it mean, the addiction field? If we also try to cover prevention and harm reduction, or if we focus only on treatment and clinical counseling. It's fortunately different for ICUDDR survey that we see that prevention is highly represented. This can be explained, of course, but by high use of universal prevention curriculum within the programs and for development of new programs. But this topic is really underestimated in other studies. Also, according to the topics or the names of addiction study programs, we can see that prevention is really low in representation. The same for harm reduction, public health, criminal justice, and law. And again, we need to discuss this. This is important and should be definitely covered, as addiction is connected to infectious diseases, to overdose risks, and we need to include these topics into the curriculum. Here we can see some biggest challenges and benefits from the surveys we made. I'm repeating that the language was a barrier, and we used Spanish for next waves. Also, we need to increase the participants' rates and also maybe consider more regional specifics of the educational systems. We need to make the questionnaire shorter, and also it can be possible that we can split the educational options, and it will be like 3 questionnaires, shorter ones, and not so comprehensive, to be easy to fill it in. And again, the benefits lays in getting knowledge of the global education, the similarities, specifics. We can collaborate, we can share the experience and knowledge, and also we can prepare a floor for some other future developments as it is in related activities and opportunities. One of them is represented by development of the international quality standards on addiction university education, which is under review for publication in the Addictology Journal. So hopefully it will be out soon. You can definitely find it on the websites and shared within the ICUDDR newsletter, which is setting the minimal requirements and some kind of competencies and standards for university-based academic addiction studies programs. You will see what we created in collaboration with NADAC and NASAC in 2021. We can see the opportunities in student and academic mobility and exchange programs. As I mentioned before, we need to discuss how to make it transferable. our education gained in other countries. It's quite common that we travel and we study in abroad, but then coming back to our home country, finding that it's not possible that our qualification is recognized in the country. So this is something what we want to support more in the future. We can create joint degrees for someone or for the universities where it's not possible to easily create a new program. It can be the way how to educate the professionals in the country. We would like to thank to the regional coordinating centers for their collaborations and activities. It wouldn't be possible to make some things without you. And also we need to focus on educating related professionals. I'm trying to finish my presentation, but at the end, I would like to get back and mention what is really important in as we improve our educational options, we increase the number of educational programs available. And and that was one of the point, and at the Greek conference from the audience, and it really touched me. And I would like to make you sensitive to getting back for the definition of how we deal with addiction, how we see addiction, and also who we think is an addiction professional, who it can be, or what competencies does he or she need to have. Is the specialization the best way how to develop the field and how to take care of addictions? These two questions are really key in what we do and how we educate the future workforce. That's what I want to end with. And I would like to just sum up that the education in the addiction field represents a lively topic with many opportunities, as you see. And it's interesting, it's passionate, and it's worth it. So I hope you could be welcome in this board and collaborate with us in this important part of our addiction field, which we are working in. Thank you for your attention, for being here with us, and I would love for you to share some comments or questions if you have. Thank you once again.
Thank you, Dr. Lososová. We do have a few questions, so let's start with it. I think this one is related to your second to the last slide. You were asking about like who are addiction professionals, but the question is about how do you define addiction science?
Thank you for this. Thank you. I wasn't sure if I'm muted or not. Thank you for the question. Thank you for relating the question to what I was finishing my presentation with, because this is really important, and this is key for all the regions around the world. For me, and we tried to make a definition in the papers we published, that we see addiction studies or addiction science. Let's use this point, this formulation. It is the whole field, covering all issues related to substance use disorders, addictions, behavioral or process addictions. And for me, as how I'm thinking about the addiction field and addiction science, it's that it's necessary to be covering all the areas included. So for me, addiction field is for everything, from prevention, harm reduction, harm minimization, for some law enforcement, law issues, through treatment, of course, aftercare, rehabilitation, and related like methods. Let's say it's clinical, it's educational, it's about research and evaluation. It's about every topic I try to cover it with my presentation, and which we try to cover it with the surveys. We try not to exclude any of these areas, and it is definitely meant differently within the regions. Somewhere it is just about treatment. And by the way, Jeff from the ISAP was sharing his point of view on this question. If the addiction professional could be also the prevention specialist. It was the paper shared within the ICUDDR website also, so you can read it. In my opinion, the addiction specialist could be able to do a prevention too, and should do preventive activities also. So this is my point of view.
Yeah,
Not generic, definition.
Yeah, and you also mentioned a little bit something about the slide, which I find interesting, is that when we talked about addiction science, we think of professionals and we recognize that this is a multidisciplinary field. So it's not one profession that owns the field, but rather we work together and collaborate to be able to achieve the goals.
Thank you for adding this important point, because without other colleagues from other disciplines, we wouldn't be able to work. Like somewhere in the world, addiction specialists are healthcare workers. Somewhere they are social workers or more socially oriented workers. It can be just counselors, just prevention workers, peer workers, people with their own like lived experience with addictions. And of course, without medical doctors educated in addictions, pedagogics, social workers, nurses, psychologists, of mental health workers educated in addictions, it wouldn't be possible to cover all related issues which are related to addiction. So definitely, we create a whole bunch of professionals necessary to collaborate and to work towards one aim we share. Thank you very much.
So the next question is country specific. Are there information with regards to addiction studies on Ghana? Do you recall on the top of your head if they actually responded to the survey and mentioned if there are addiction programs in their country?
I don't think so, actually. I think within the ICUDDR survey, but just don't want to be mistaken in sharing what is not true. I can definitely share the data with the presentation afterwards. I can add the data, but if you could read the paper from the ICUDDR survey, there should be the university representations, and I think Ghana was not definitely in the mapping survey, but we possibly discussed some other programs and trainings available in African universities, which were not identified through the survey. But we discussed it about what we knew, because one of the authors, or more in the authorship team, was African. So we tried to cover the whole field, but I think Ghana was not represented. I just want to show you the paper. It's small, sorry for that, but you can then read it properly later. But the number one, the paper, the first paper is for the ICUDDR survey data, so you can download it directly on the link and read it as you are interested.
Thank you. Okay, the next question is a little bit tricky, but they are asking for if you are aware of or can share any information about scholarship for addiction studies. Like you can answer Europe, maybe I can answer the US in a little.
Thank you. If the question is focused on the Czech Republic, then I can share that the studies in the Czech Republic are unfortunately available at the bachelor's and master's level only in the Czech language now. But we are really close to opening the English parallel studies at the master's level. And these will be like for, I think some estimations for the fees were it was, oh my God, I know it in Czech crowns, but it was not so much. I can share it with you if you're interested. Just email me. I can share the link and connect you to my colleagues. Adam Kulhanek, who is responsible for leading the masters in English language, which we prepare. And we have a possibility to study PhD program in English, of course. And we have some students here from Malaysia, from Asian countries, which they are sitting in the same floor as I am here in the department. And the doctoral studies are for some low fee or for free of charge, absolutely. So this is absolutely available. If you could study here in the Czech Republic, that could be the only cost you can have with the studies. Just getting the visa for stay, because it's mostly like necessary to come here at least for some times, or you can live here. That would be the case of the masters. But Nesha from Malaysia she's living here, and it was somehow possible for her to pay. It's not so expensive to live in the Czech Republic, so hopefully it could be available for you. We don't provide scholarships, as our university doesn't have money for these, but it is, I think, I can say it's available for anyone.
Thank you. And I guess this is one of the tips that I can give, because I myself am a recipient of a fellowship in the US. I am not from here. But there are normally, when we look for scholarship, we go to this big like scholarship grants. But in actuality, universities in itself have their own scholarship. You just have to actually follow and check the program if that suits you. So I put in the chat box some of the universities where they offer addiction studies, and you have to go to those individual university websites, look for the program and the department, and then attend their open house, because they will tell you, like most of them would actually have their own fellowships available would that would enable you to study and pursue addiction science. Because like I know that in most part, if you're from Asian and African countries, the higher degree programs are basically not available. So that's one of the we are near to the end, but there's a question that I think we should answer, because it talks about how ICU DDR can help in establishing program. There was a question there a little bit about funding. So very rarely will you be able to get a fund to actually, like, financial grant to start a PhD program in your own country. However, there are technical assistance that are available that will be able to support you in, like, finding out what to do, what are the legwork. And it's a little bit challenging in the sense that we cannot have a blanket, a universal answer for everyone, because each institution, each country will actually have their own policies in terms of establishing a new curricular program, right? So that's something that you have to be aware of, something that you have to be mindful of. What's the processes of establishing a degree program in your institution? What are the laws that encompasses this in your own country? And then what ICDDR can provide are technical assistance. I put in the chat box, and if you visit actually our website, you'll be able to find resources, including the references on how to implementation guide for establishing addiction education and training programs. So there could also be, you can also fill up the university request form for consultation, and someone from our team will get back to you. So that's what we can say with regards to how ICUDDR can help you. But so, are there any other more questions that you would like to ask? So we have 2 more minutes before we end. So we hope that we are able to answer your questions. And so if there's one more last question, we are here. So, okay, so we would like to thank Dr. Lososová for her amazing presentation. There's a lot of accolades in the chat box, so they are very appreciative of their of your presentation. And we also want to thank every one of you who are here. We're very happy that you have that you are here with us. And we would also like to invite you, if you are interested to know about the conceptual processes of moderation and mediation, that will be our next webinar on September 9 and 16. And we will also have a webinar on September 25 in partnership with ISAP on co-creation and prevention. So please visit our website or follow our social media pages so that you'll be able to register into our future webinars. But actually, before we end, I can probably copy, hold on a second. Okay, I am sending the link for the future webinars that we will have on September. So we hope to see you there. And again, thank you so much. So great presentation, Amalie. Thank you for accepting our invitation. And again, to everyone, thank you and have a great day.
Thank you
So
very much to you all. Have a great time. Thank you for being here. Bye.
bye.